Hoffaday Church. In this next segment, entitled Mythbusters, I would like to tackle some of the misinformation that you're experiencing through social media, the internet, and chat groups. Misinformation spreads much like a pandemic, infecting people with bad ideas, leading to bad habits, a false sense of security, or a lack of compliance with mandates and guidelines put forth by our government officials. Let's look at 10 common myths circulating on the web. Myth number 1, drinking water regularly or gargling will prevent infection with the novel coronavirus. The logic behind this myth is that you rinse the viruses that are in your mouth down your throat where they enter the stomach and are killed by the stomach acids. On face value, this logic seems sound, but in reality, the majority of your breathing occurs through your nose. So rinsing or gargling is not going to have any effect of the passage of viruses through your nose into your respiratory tract. Second, we know that coronaviruses in the past have demonstrated some resistance to acid, so the novel coronavirus may not be killed in the gastric acids. Myth number 2, regular nasal washings with saline will prevent the novel coronavirus. Nasal washing has not been shown to reduce infection from other coronaviruses and has not proved to prevent other types of viral infections. The reality is that normal respiration between any kind of therapies, whether it be nasal washings or other types of therapies, will not affect the passage of respiratory droplets harboring the novel coronavirus from passing into your lungs and causing infection. Myth number 3, the novel coronavirus is a supervirus made up of the genetic material from many other viruses like HIV or Ebola. This myth is false and also ridiculous. The novel coronavirus is part of a family of viruses like SARS and MERS, and not a compilation of any other virus, whether it be Ebola or HIV. Myth number 4, the novel coronavirus was engineered in a Chinese laboratory to be weaponized against the United States. This myth is false, and it goes along with a number of other conspiracies that we'll read on the internet. As we've talked about before, the coronavirus is part of a family of viruses that are known and studied and include the SARS and MERS outbreaks in the recent past. These viruses have a reservoir within mammals and birds, and in the case of SARS, likely originated in bats and was transferred to an animal called a civet. And in the case of MERS, also originated in bats and probably was transferred from camels to human. Myth number 5, garlic can cure or prevent the novel coronavirus. This myth is false. Garlic is delicious, and we know that it has properties that can boost the immune system, but is not proven to prevent infection from the novel coronavirus. So although it's helpful to add garlic to your food, and it may actually help with social distancing, it's not going to prevent infection with the novel coronavirus. Myth number 6, if you can hold your breath for 10 seconds, that means you're not infected with the novel coronavirus. This is false. We know that the coronavirus has an incubation period between 2 and 14 days in which you are completely asymptomatic and you will not have any difficulty breathing, and you would not have any problems holding your breath for 10 seconds. So this is false. If you can hold your breath for 10 seconds, it means that you can hold your breath for 10 seconds and nothing more. Myth number 7, antibiotics can treat or prevent infection from the novel coronavirus. This myth is false. Antibiotics are used to treat bacterial infections and not viral infections, but a host of antiviral treatments are on the horizon and being tested as we speak. Myth number 8, vaccines against pneumonia will prevent you from getting the novel coronavirus. This myth is false. The current vaccines that we have in place against pneumonias are very specific and will not have an effect on the novel coronavirus. Myth number 9, The coronavirus is affected by climate. So one version of this is that cold or snow will kill the novel coronavirus. The other version is that the novel coronavirus cannot be transmitted in hot or humid climates. Based on the current information we know about the novel coronavirus, that cold temperatures or snow do not seem to kill the virus, nor does the virus have any trouble being transmitted in hot or humid climates. Whether or not this virus demonstrates seasonality like the flu will be determined. Myth number 10, spraying your body with alcohol or bleach will kill the coronavirus and ultimately prevent you from getting infected. The reality is that bleach and alcohol are effective in killing the novel coronavirus, but both these substances are damaging to the skin and to the mucous membranes, so they're not advised to be used on your body. Instead, use proper hand washing technique as an effective way to decrease your risk of contracting the novel coronavirus. This concludes our segment of Mythbusters. I hope this was helpful in navigating the flood of information we're experiencing from the internet, from social media, and from our chat groups. Thank you, church, and God bless.